Welcome to the Downtown Somatic Therapy podcast, I guess I would call it. I'm Avi Klein, the clinical director, and I'm here with one of our senior clinicians, Melanie Berkowitz. And Melanie, the reason I wanted to speak with you is because you have the most viewed article on our website, which is about 5 different kinds of somatic therapies. So it's clearly something about that is interesting to people, and I would love to talk to you about it because I think people are interested in incorporating the body, and I'd love to talk to you about that. And there are meaningful differences in the different approaches that we use, and you're trained in a number of different approaches, so I think you're a great person to talk to about that and to help people understand what kind of therapy they might want if they want to do a therapy that incorporates working with their body more. So thank you for joining me.
You're so welcome. Happy to be here.
Before we get into any of that, I am curious for you, what drew you to focus on working with the body as a therapist? How did you kind of arrive there? Because it's not such an obvious choice.
Yeah, for me, I had a personal experience before I went on to becoming a therapist, which definitely influenced me to be a therapist. As a young adult, I was living in the Midwest, and I was going through a personally difficult time. And a friend of mine connected me to the Gestalt Institute of Cleveland for a personal growth group, a support group, and I joined. And I didn't really know what it was, but it turns out the facilitators there were trained in different somatic approaches, and the group was really life-changing for me. And I had been in previous talk therapy, but the work that we were doing together, the focus on the body, really stirred up within me a lot of unresolved stuff, unresolved grief that I just never really dealt with in my other talk therapy. So it really offered me a sense of hope and trust in my own process and trusting my own body, which was really important for me. And so, yeah.
Well, I mean, you're saying something that I would love to just like highlight for a moment, which is that you'd been in talk therapy before. You get invited to this Gestalt group. You don't really know what to expect. Stuff that you had worked on in therapy is coming up, but it's coming up in a different way.
Yeah.
Can you speak to that? Yeah.
Yeah, that's such a great question. I remember the facilitators, when I would bring something up in the group, I think I was going through a breakup at the time, and there was just a lot of feelings, and they would always say, slow down. If you drop the story for a moment, like check inside, what's there? And I didn't really understand what that meant, because I was like, well, this is my story, it's important. But when I followed sort of the slowing down, there were so many emotions inside of me that I didn't even know were there. And their support and their guidance really allowed me to trust that I could go there. And so I was making associations and connections to, how this thing in my personal life was also related to other things in my past. And it sort of transcended the story, the narrative I was telling myself. And it was just a really powerful way to say, oh, I don't have to be so scared of my body. I don't have to be so scared of what's inside underneath the surface. And they allowed me, through slowing down, through that focus, to be both attentive to what was happening in my body. And it helped me make a lot of sense of why I was struggling earlier, because I think I was just stuck in certain loops about myself. And something about being with the body allowed kind of an innate healing capacity within me to kind of awaken.
You're reminding me of something, while you were speaking, I was like thinking about one of my first experiences in working this way as a client. And I also remember just a deep well of emotion that I hadn't realized was there, and that only in slowing down and taking my time, a lot more came to the surface. And it was like this experience of it felt very real and true, which is funny because you would think that if we're talking about these things, there's something about talking and insight, you would think like you're getting at an understanding, and yet it really felt true in a way that is kind of hard to convey. I'm trying in this moment because I think this is like the appeal for people, but when it feels true, it's like you feel like you're in touch with something that was there all along, but you just didn't know it. Is that, I don't know. Would you say, am I getting at it in some way?
Yeah, I mean, I'm really resonating with your experience, and yeah, that kind of felt sense of something being true inside, really spoke to me. And the first experience with it was kind of uncomfortable. It was like it was new terrain. I just didn't have I didn't know where to look in my body. But once I sort of slowed down with it, yeah, I think our bodies are really, as mammals, we're naturally, emotions are really adaptive. And so there is this sort of organic process of moving through feelings, even if they're difficult, even if it's painful, that is trying to support our systems to move through something, to transform it, to find relief so we can be present. And that's what I felt. It's like when you kind of feel like you're on the other end of an emotional wave, and there's just sort of this relief and sense of wholeness.
Yeah, yeah. So we're both talking about our own experiences as clients, but can you share a moment as a therapist where you similarly witnessed someone having a breakthrough when working with the body, incorporating somatic techniques?
Yeah, absolutely. There's so many moments. I was recently working with a lovely client. She's very self-critical and has lots of anxiety. It's sort of her kind of normal experience is just feeling anxious all the time.
Mm-hmm.
And it's really difficult for her to slow down and connect comfortably with her body, just because what she experiences is just comfort, is that anxiety. So I wanted to really help her slow down so we could get underneath the anxiety to see what else is there. She was recently sharing about her love of storytelling and connecting with close friends, and I just noticed her eyes widened, there was sort of a smile. It was just a moment where it was a little bit different than that normal anxiety, way that she often shows up. And I really invited her to slow down on those positive feelings, the warmth that she was noticing in her chest and stomach as she was talking about her love of her friends and her story and storytelling in general. And I just encouraged her to hang out there. And when we slowed down in that place of positive feeling, she felt so much pride because she was so proud of being so open with other people. And, she was noticing, she's like, oh, this is making me realize in my family of origin, everything had to be okay. And I had to kind of wear a mask for most of her life, like not share her emotion. It wasn't okay to not be okay in her family. And so as we were deepening into this pride of her being authentic, suddenly this well of grief and sadness came through. And she really was just grieving for all those years growing up where she couldn't really be her. And what I think is so powerful about that example is that, she was kind of naturally, from this place of emotion, she was making all of these insights suddenly from the feeling into how alone and disconnected she had felt growing up, and how different she built her life as an adult. And it was through actually supporting her with positive feelings about where she was in the present, that she was able to move underneath the anxiety, and kind of let go and move through a lot of grief related to her childhood, and clarity about her ability to be more open. So I think it just shows that, it was almost like just a moment I saw. I really supported her to slow down with it. And from there, she got to feel into all the pride and who she's become, but also, move through what wasn't, what she didn't have, and kind of find some relief in her body. And she kind of said to what we were describing earlier, like, I just feel calm, I feel relief. There was no anxiety at the end of our session, and she'd never really had that experience before. for.
So I love that example, and one thing I would love to just take another moment to talk about, because I just think that for someone who doesn't have this experience, this might be surprising to them, which is that kind of a hallmark of a lot of body-oriented therapies is we like talking about positive feelings, and we're a little bit more interested in that than your traditional talk therapy might be. How would you explain that? Like, if I can put you on the spot, how would you explain that? Why do we do that? Why is that helpful in therapy? Because I have clients all the time who sort of fight me in, they don't want to talk about what's feeling good or what went well. And why is this
Yeah,
important?
I think, yeah, I mean, in AEDP, which is the hallmark of that therapy, which you and I are both trained in, alongside other somatic therapies, really wants to prioritize positive feelings when they're naturally emerging in session. And I think that's because, I think there's a real stance in a lot of somatic therapies, because we're focusing people to be with exactly what is, that, the body has an innate healing capacity. It kind of knows, there's some kind of system that even when we're stuck, if we can kind of, peel off some of the layers that block us from that healing capacity, it's there. It's always there. And so I think when we notice organically positive emotions coming through, it's like we're sort of seeing that glimmer of our body's innate capacity to take in something positive.
Yeah.
And I want to be clear, it's not about being, Pollyanna-ish, because
Yeah.
I think, a lot of people are coming with pain and painful experiences that we need to move towards and look at and transform. But there's also, alongside that, there's already this well of goodness that exists. And I think the more we tap into what's already there and supportive and already resourcing to someone in their system, it really supports them as that resource to move into what's harder and more difficult.
Yeah.
And so, yeah, I think that's what I would say is like it's already there, and we want to let clients know, they already have this innate capacity to feel better if we guide them toward in that direction. And it can feel really good for a client. They don't know. A lot of clients don't know that they have this, and it can just support them to also then move into work that might be a little bit more challenging.
Yeah, I'm also thinking, I think that was a great answer. And I'm remembering you and I did some somatic experiencing training together, and I'm remembering there's this idea that people who have experienced, who are trauma survivors, who've experienced trauma in their lives, tend to, we might say, over-index on negative experiences, right? That's one of the ways that we respond to a traumatic experience is we anticipate another negative experience or traumatic experience happening. And I guess I'm thinking about that training because a part of that, and I think you tell me a part of Gestalt as well, is sort of like gently reminding yourself that there are other things happening outside of our bias, right? And so that another benefit of staying with the positive is because we don't really give it much attention ever.
Yeah, and I don't know where I've heard this or where this comes from exactly, but I've heard that, our systems, this is like a survival mechanism when there's trauma, kind of encodes negative experiences with like at least 3 to 5 times more power, because our body's saying that was scary, we don't want this to happen again. If I'm always worried about or trying to prevent something bad from happening, evolutionarily that might be supportive if we don't want to return to an area where we were running away from a predator. But what happens then is that we don't actually internalize and metabolize positive experiences in the same way. So part of our work is helping people see what support they already have. And alongside, the painful stuff, the trauma work is like, hey, there is resource here. And we have to, it can be hard work to help someone really see that and orient towards those aspects of their life.
And I think just to tie it all together, it's really about feeling it, isn't it? It's not, right? It's very easy to tell someone like, hey, life's not so bad, or look at all you've got going for you. And most of us would be very annoyed if somebody said that to us. But but feeling something that genuinely, authentically feels good is a very different kind of experience. And I think that's what we're after here.
Yeah.
So you do have training and experience in a bunch of different modalities. As a therapist, how do you think about what approach might be best for a new client as you're getting to know them?
Yeah, it's such an important question. And I'm trained in Gestalt, in AADP, EMDR, and some somatic experiencing. And again, they're all somatic-based therapies. And I like to integrate my approaches. So generally, I will start with when I'm working with a new client, my stance, I usually start with AADP and Gestalt, because these modalities really help me assess, how a client is able to take in the somatic approach and also benefit from our relationship, because I really, the way I work is I really believe that our relationship is one of the main recipes for healing. And so what I'm looking for is, is this person kind of able to drop into their body with my support and access deeper emotions that kind of help them get underneath their symptoms and find some relief. And for some people, it's really supportive, that work, using the Gestalt and AADP somatic approaches. And then for some other people, I notice there are specific stuck places or like traumatic holds, and that deserves a specific kind of trauma-informed approach. And in those situations, I might engage in EMDR if there's like a specific memory or kind of way that they're in their body that keeps on getting activated. We can use EMDR to really specifically address a trauma pattern in their body. Yeah, and then for some people, they come in and really their thoughts are racing so quickly. It's so hard for them to get out of their heads, even with some of the approaches. And with those folks, I'll use specific interventions, parts work to really help them address like negative core beliefs or like self-punishing thoughts that are really blocking their access to feeling. And that might take some time to do that. So, and then I'll use somatic experiencing, especially with clients who often feel like emotional flooding or overwhelm when they're in session, because there are a lot of somatic experiencing techniques that help someone better regulate and soothe their nervous system response during and in between our work. So that's also a nice tool to use.
Yeah. And it's like there are different needs. There's processing things. There's regulating and grounding, right? There are lots of different needs that people come in with, and there's sort of repetitive behaviors or particular ways of coping that might need to be worked through before you can go deeper, and there are different approaches that kind of work with all of that.
Yeah, exactly. So I'm sort of seeing like, where's the client right in that moment, and what's the best modality that will support them with where they're at.
Yeah. Okay, I'm going to move to, although I love talking with you, so we'll see if these are supposed to be shorter questions, but we'll see how short we'll see. I think you and I both have this experience where people will reach out and be interested in somatic therapy. And I think people have a lot of ideas about what that means. What's one thing in your experience that people get wrong about working with the body?
Yeah, a lot of people will reach out assuming that there's no talking in somatic therapy, or as a somatic therapist that I don't care about someone's story or the context of their life. And I think that is a misconception. Working with the body, while we are really slowing down to help someone notice what's happening in their bodies as they're talking about the important issues in their life, it's adding another layer and dimension related to the important stories that clients are bringing in. So I'll often say, we pay special attention to how someone's story or situation lives physically inside their body.
Yeah.
So that they can transform and relieve any stuck holds in their body that are often related to negative beliefs. And in doing so, will help clients shift the self-critical narrative to one of self-acceptance. And that's adding the layer of the body to help accelerate that process.
Yeah. Yeah. I to be honest, it's an area I know less about, but I know that there are therapists who might work in a way where there's just, physical movement or processing things without words. But you and I are not really drawn to working that way. Yeah.
That's a great point. There are some somatic therapists that do, really prioritize that. But it's not, some people will come in being like, it's kind of like, is it touch? Is it massage? And
Right.
It's not body work.
Right.
At least.
It's like working through the body.
Yeah. And kind of coaching someone to learn how to notice what's happening in their body.
Yeah. So much of this conversation is about trying to convey to someone what working with the body is, how it's different from talk therapy or our other ideas about therapy. So if you could explain to a 10-year-old what somatic therapy is, how would you say it in a way that a 10-year-old could understand?
Yeah, I would say that emotions are important and they show up in our bodies. And sometimes they act like icebergs. So often we only see the tip of that iceberg. We have a sense we might be feeling something important, but we don't always know what's underneath. And somatic therapy can help with that. Because as mammals, we're biologically wired to feel emotions. It's really healthy to feel, and sometimes those feelings are painful or difficult. Like when we lose something or someone important, we get sad, and that's healthy. We can cry and grieve, so we could say a proper goodbye and feel more connected to the present moment. But when we don't face those feelings, they kind of get stuck inside of us like a frozen iceberg, and they can create anxiety in our body. And working somatically helps us notice what's happening underneath the surface so we can melt those icy places and find more freedom in our bodies and general well-being and peace overall.
That's lovely. Lovely. I'll have to think about it. I'll share that with my kids.
Yeah.
We got a 10-year-old. So for someone who is completely new to this, maybe watching this at home, could you offer some kind of exercise they could do right now that would help them just get more in touch with their bodies? What would you suggest?
I would suggest a body scan. So you could take a body scan for a few minutes, go from your head all the way down to your toes. And the prompt I'm going to offer is notice sensations as you pass through each area, right? So going down and label each of those sensations, pleasant, unpleasant, or neutral. And just notice as we tune into each place, if there are any parts that are uncomfortable that you want to fix or change, especially those unpleasant sensations when they arise. And if that happens, just take a breath and then return to the body scan. And if you're having difficulty staying for a few moments with an unpleasant sensation, you can move to an area that's a little more neutral or more pleasant for a few moments, and then return to that unpleasant sensation and continue downward on the body scan. And I like this exercise because I think it helps us really recognize, the paradox often is that when we accept exactly what is in the present moment, even when it's sometimes uncomfortable, the more we can tolerate it and access our genuine kind of compassion for discomfort and help us realize we actually have more ability to tolerate something uncomfortable than we think.
Yeah. Yeah. We like to say the only way out is through, right? So something about being with things change as you're able to be with them, and there is a sense of moving through something versus it being uncomfortable and having the natural reaction to resist, but that often just sort of reinforces it.
Yeah,
Yeah.
exactly.
Okay, last question for you. What are some physical signs that someone has trauma stuck in their body? If, again, thinking about someone for whom this might be new information, what would you sort of suggest they pay attention to that might suggest incorporating their body might be helpful for them?
Some examples of physical signs of trauma is like feeling really contracted muscles or panicky feelings like your heart rate is increasing or you're hyperventilating or you're immediately freezing up or going numb. And a general sense that maybe your physical response to a situation in the present seems disproportionate to the context.
Yeah. Yeah, I think we're always, it's like, we're often talking about extremes. It could be disproportionately big or disproportionately small, right?
Yeah.
If you sort of are the kind of person, maybe people think you're very chill, but actually you're just sort of like not responding, right? That would be another example.
Yeah, like sort of frozen up to things that are happening that, would be
Yeah,
important to respond to or helpful.
right. We're sort of like, the goal is a kind of flexible engagement with the world, and if you're having big feelings that seem disproportionate or you're not engaged at all, then there might be a bigger story behind that.
Yeah. Yeah, and I always say, don't there's nothing wrong, but let's get curious,
Right.
okay. Oh, that was I'm surprised by my reaction. Yeah, let's get curious and notice what might be happening in that moment for
Yeah.
you.
Well, Melanie, thank you. Thank you for taking the time. And if people are interested in working with you, they can find you at our website, downtownsomatictherapy.com and /Melanie, and they'll find your landing page and they can reach out to you.
Yeah, thanks so much, Avi.
All
Appreciate
right.
it
Thanks.
as always.
Bye.
Bye.